Okay, today's first day of December. This is our last face-to-face class here, and we're going to be going over Mod 43. We're going to be watching a few videos and discussing them. And I'm going to show the videos in the film, so you don't have to go look it up on yourself, but they are available on Blackboard as well. So before class started here, we were talking a little bit about the James Holmes case. He was the joker in the University of Colorado shooting in Aurora, which is a suburb of Denver. And we'll discuss that case as well as a couple others. So we're going to start off with the video, and I'll go turn the lights out so you can see better. This is a training video. I'm sure they were probably using it for medical students because it's fairly simple, but it does have some medical issues as well as some psychiatric issues. So all of these patients are in a mental hospital or mental institution, so you can assume they're all on medication. So the things that they are saying and the way they are acting, they are being treated with medication, and yet they're still showing you some of these symptoms that you have on your list of diagnostic category from DSM-5.
Tomorrow to see whether or not there's any legal basis why you have to stay here.
I'm not crazy.
If it was up to you, would you like to leave the hospital tomorrow?
I'd like to leave the hospital tomorrow because I've got things I gotta do.
Okay, well, I'm gonna be.
There's a lot of rent to be paid and all that.
Okay, what brought you into the hospital?
Now notice if you have a list of symptomology that's associated with schizophrenia. Number one, A1 is delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms, okay? So you can be listening and watching for any delusions, hallucination, or disorganized speech. At this point, this guy sounds pretty good. The only thing that would give you a clue that something is not quite right, other than the fact he's in a mental institution, is his contact with the person that he's talking to is not very good. He's not looking you in the eye. He doesn't seem to have much emotion associated with his conversation, and you'll see more examples of that in a minute.
I killed myself down at 5150 because I felt like killing myself.
Okay, so you came here voluntarily.
Played myself and killed myself.
And what was going on that you felt like killing
It was
yourself?
3 o'clock in the morning. I couldn't sleep. All the same thoughts kept racing through my mind over and over and over again. I just wanted them to stop. Period. Then I thought, well, if I kill myself, I'll stop thinking.
2 types of symptoms with schizophrenia: positive symptoms and negative symptoms. It's like the same issue when we're talking about reinforcement or punishment in behavioral management. Positive is not good and negative is bad. Positive means something is added, and negative means something is taken away. So in this case, they're saying he has a lack of expression. He has flat affect, which he does. He's talking about some really important things: trying to kill himself, being institutionalized, and he's just talking about it like he's reading the newspaper. So that's flat affect. And that is a negative symptom because his normal emotions are not there.
And I said, well, that's too good an idea either, because you've got friends and people around you who love you. So I stopped that thought. And I said, well, who am I gonna call? I call up Ghostbusters. I mean, no, that came out wrong. It's a joke. Anyway,
That's a joke, but it's a good joke. But he's not laughing, nor is the woman who's interviewed. She's dealt with so many patients. She's taught herself not to laugh because the patient might think that they're making fun of the patient, so she just lets it slide. But to you and me, it's a pretty good joke, actually, but he's not laughing. It's part of his personality, but he's exhibiting flat affect.
I didn't call Ghostbusters, I called it Preston's Intervention
Okay.
Center. I talked to them on the phone. They said there was nothing they could do for me for one night. So I wound up here by ambulance. Paid ambulance ticket.
Okay.
Mr. Preston's Intervention couldn't do anything for me.
Have you ever made,
Now, I don't know whether he's telling me the truth or not, but he certainly makes sense. He can quote this California state statute about self-admitting into a mental institution. He had to pay the ambulance to take him there. So he sounds like he's making a lot of sense. His thoughts are very well organized. He does not show disorganized thinking at this moment.
any suicide attempts?
Oh, yeah, I have a couple of them when I was 19.
Okay. Are you usually able to ask for help when you start feeling like that?
No, I was never able to ask for help before.
Okay, so this is a new thing.
This is a
You're
new
coming
thing
into
for
the
me.
hospital.
Yeah, when
Okay.
I came in here, it's unlike any other way I've ever come into the hospital. That's people, please help me, so I do not kill myself.
That's all the questions I have for right now.
I will not give them, I'm getting very uncomfortable out here. But somebody might be trying to shoot me.
So he keeps it together for 1 minute and 56 seconds, talking to this advocate who's going to appear with him in the court hearing, which is going to happen inside the mental institution. And he loses it at the very end. After she says, I'm done, yeah, I know you want out, and looks like you're doing good and all that stuff. Then he says, I need to get out of here because I think somebody's trying to kill me, they're gonna shoot me. So he's paranoid, which by the way, does not mean he needs to be in the hospital. He turned himself in allegedly because of suicidal ideation, which could be true. And that is something to keep him hospitalized, but he's not talking about that now. So in all likelihood, he may well get out the next day. Because just because you're suffering from schizophrenia does not mean you need to be hospitalized.
I got TV2 thing off. TV2, I'm surprised when they put on the news count. And they listen to news for years, if you know it or not. I didn't know it.
Now that is delusional thinking straight up. He calls himself TV Tooth because he gets messages through his teeth from the outside, Martians or CIA or somebody sending him messages. It's a very common delusion. I don't know whether either of you know anything about street drugs, but if you take a look at this guy's tooth right there, that looks like a stalagmite from Carlsbad Caverns. That's from smoking meth. Meth just eats the enamel off your teeth, and your teeth start turning brown, and they get pointy like the stalagmites in Carlsbad Caverns. So he's clearly somebody who's been using street drugs, which is not unusual when you are chronically mentally ill. The prescribed medicine that you take generally has all sorts of side effects that you don't like, but yet you don't want to be mentally ill, so you run to street drugs to get high or to get away from your mental confusion and problems. And so it's not that unusual for somebody who's been mentally ill for a while that they have done a lot of street drugs.
And they have this really fantastic, expensive equipment. They touched me, man, they said to me, hey, we can check your head, you know, for, if your bump shows up bruised and the electricity is a little different across the scalp, your scalp, we'll guarantee social security from that injury on its own.
So what he's probably talking about is he had an EEG, electroencephalogram, where they put the same exact pads they put on for an EKG, which goes onto your heart, in your heart area, and EEG puts those little conducting pads on your head to look at the brain waves in your head. And somebody has done that, more than likely somebody has done that with him, and the technician who is testing him to get him to cooperate told him the truth, which was, look, dude, let me do this exam. It doesn't hurt you. I'm not going inside your brain. It just sits on top of your head. And if you have problems, then you're going to qualify for a monthly payment that will pay for your housing and food and whatever for the rest of your life. So let me do this test. So as very common with people with schizophrenia, part of what they say is based in reality and part of it's delusional. But these are some pretty good delusional thoughts, and he's got a lot more.
It's considered like cerebral palsy, but it would be muscular dystrophy kind of thing. And so I said, no, next week, did you think about it? Get it right, you know. Okay, I'll look at it. Okay, let's go. And they put the needle in. The last one they went like this. So when they did it, I had a thought, but when they pull them out, they pull them out first, but they left a little teeny little barb and all, every one of the places they put me. And they recorded it. And one person wanted it, didn't. Someone else sold it to someone else, I don't know who, but they're able to give a response back because of how thick the dental is in my teeth. How thick the dental is. And with the needles, they're easy to focus a heavier field of pickup reception because of all the fillings I got. And so I think it's people like at Stanford and technicians, wealthy technicians.
So whoever's interviewing asked him who was doing these tests, and he said somebody from Stanford, which is, he may have been treated at Stanford. He's in California, and then he says wealthy technicians. Well, he's been seen by a lot of technicians, I'm sure.
Wealthy technicians, people that do stuff like NASA or what in that sense. Ames Institute. I came right up to them and tried to sell them the last one. But for the normal money, they didn't have it, I just gave it to them.
So he's now talking to people from NASA, and he wanted to sell them these diagrams for spaceships, but they didn't want to buy them, so he says he was just going to give it to them. Now, this lady is really smart. She has probably been bothered with mental illness probably her whole life. She's got some great insight, but she has definitely got some thinking problems. This is Dr. Llewellyn, who is a psychiatrist and is quite good. One of the things that's the other interviewer did pretty well, and Llewellyn will here, is that he doesn't talk too much. He lets the patient talk. And of course, this interview's been edited, but the point is, some of us who are all energetic, we want to get in there and start asking a lot of questions. And sometimes it's better to just let them ramble on a little bit, and then if they get off topic, bring them back to topic. And that's exactly what Dr. Llewellyn does here. Or Llewellyn Bigelow.
I get to the point where I don't want to live anymore because the mental process of mine takes over. When I think I'm doing good for a while, something mental takes over and it scares me. Years ago, I didn't do that. Years ago, I didn't have to worry about that one thing. I was one less.
This is just a little message. Greater than 6 months of continuous social and occupational dysfunctions. That's one of them that's on your list here. This woman is a paranoid schizophrenic, and she is not lying when she says that it's very fearful, it's very scary being mentally ill because you can't control your mind. In her mind, will tell you in a minute that she used to be more healthy than she is now. Didn't used to bother her as much. So another interesting thing for any of you who are going to go into the clinical field of actually being around patients is their social interaction. And you'll notice that most of the people who have been interviewed here really don't have much interest in looking at their interviewer. Like if you and I were having a conversation, we would look at each other. But there are certain times in the conversation where she does look him right in the eye. And there are pivotal points where some emotion might come out. One of them is she's about to insult doctors, and she knows he's a doctor. So just before she says it, she looks him in the face to see how he's taken it. And this guy, of course, is cool as a cucumber. He's all good. And so she goes ahead and says it. You'll see it.
I was one less paranoid. I mean, one less crazy.
There's your list.
I was one less crazy. I mean, years ago, I didn't have this new mental problem. I don't know what it is. I don't know what it is, but it's pretty scary. That's why I called the police. Nobody else is doing it. For those people at 7-Eleven, they're always on the phone talking about me.
There's the paranoia. People at 7-Eleven are always talking about her. And then she's going to talk about them getting on the phone and calling about her.
Always, especially in the summertime, nice weather. They're always talking about me, calling hospitals, Barnes, St. John's. There's a lot of doctors that,
Whoops.
there's a lot of doctors that,
There he goes. She's about to blast doctors. And then she goes, whoops, thinking, oh man, I'm sitting with the doctor. I better watch what I say. She looks him in the eye. He's not bothered. So she goes ahead and says it.
not 7-Eleven, Quick Trip. You know what Quick Trip is? There's always a lot of doctors and nurses going there making for like kill her or do something to her.
Do you notice changes in your attention, with your illness?
Huh?
Do you notice changes in attention with your illness?
I'm retarded.
He's refocusing her on the question, do you notice you have issues with lack of attention because of your illness? Her answer, nothing. She's lost concentration on what he says. So he brings her back to the subject, and then her excuse is, I'm not retarded.
you notice having problems focusing attention or keeping your attention on things?
Yeah,
Tell me about that.
I don't know.
Now she's getting emotional. Now, this is true emotion. This is based like you and I would feel when somebody's asking something that's painful. This is appropriate affect. But in a minute, she'll show you some inappropriate affect.
What was that again?
When's the last time you felt good?
I don't remember. It's killing me.
That is a really good question. When is the last time you really felt good or happy? Look at that face. She is a tortured woman, like most people are if they have a mental illness. Very difficult for them.
It's keeping me from having a boyfriend, keeping me from drugs. It's killing me. Like in China or somewhere. I just believe if somebody's been suffering years ago, they should take an OD and die because psychologically, they may not want to take the OD, but to get out of their misery, they might.
Out of the mouths of babes and schizophrenics, that is an excellent, correct insight into some people who have mental illness. They go ahead and take an overdose to get their life over, not because they're depressed, but because they're so tired of fighting against the mental illness and getting somewhere and then getting kicked down again, that they just decide to end their life. That is absolutely true. You saw the stats earlier about how many people, what percentage of people have suicidal attempts, and then how many actually succeed. And it's quite a few people.
They fight it every night. And every day, he's always fighting with me. Michael's always fighting with me. Josh, Dad, Keith,
Now, this might be somebody who exists, Michael. Might be somebody who exists. It might not be somebody who exists. It might just be a voice in her head.
retarded bitch. Oh, that doesn't mean shit to me anymore. I'm so used to it.
Hearing
I do have a brain problem. But I don't have a brain
How are you doing? I'm sick and feel as though people want to call me here to electrocute me, judge me, put me in jail.
His nervousness with his knees,
Kill me, electrocute
going
me,
back,
so the sense
pulling and twisting his hair. That is not because he suffers from schizophrenia.
Is,
Typical antipsychotic, although they don't know how to spell psychotic. Psychotic side effects makes me feel good because I misspell all the time in front of you. Extra, I don't know who typed this, should be an A there. Extra pyramidal symptoms. That's what he's expressing. Because of the type of medication, I'll tell you in a minute, I think he's on Halidol, is an antipsychotic medication. It's one we don't necessarily use so much. It's an older drug, but it does make you have those involuntary movements and twirling your hair and pulling it and shaking your foot and knocking your knees together. These other two are physical, biological based problems, not anything else.
it's not a new feeling, no. I'm scared of people.
must be very frightening for you though. Feel like you're running into those.
I'm so scared, I can tell you that picture's got a headache.
That's disorganized speech. I'm so scared, I can tell you that picture's got a headache. I mean, that's just complete gibberish that is often heard from people suffering from schizophrenia.
Can you tell me more about that? The picture has a headache.
You want to know?
Look at him. Can you tell me more about that? He looks down, then he looks right into the face of Dr. Bigelow and says, do you really want to hear about it? And he says, yes. And then he goes and tells him.
Yes, it is. Okay, when a sperm and egg go together to make a baby, only one sperm goes up in the egg. And when they touch, there's two contact points that touch before the other two. And then it's carried up into the air. And when they fuse, it's like nuclear fusion, except it's human fusion. There's a mass loss of the proton. One heat abstraction goes up in the electron, spins around, comes back out into the proton to form the mind, and the mind can be reduced to one atom.
At this point, what would you like us to do for you?
I'd like you to get me off the steroids, get me dried out, cleaned up, so I can go home, get a job in a bakery, go to medical school.
So some of those thoughts might be correct. Maybe he has worked in the bakery. He knows that smoking's bad and drinking's bad, so he's trying to do something about that. And the part about medical school might just be a comment that he appreciates the physicians in his life that have tried to help him. And so that's why he wants to hypothetically consider going to medical school, which of course is not going to happen. This is somebody who's suffering from catatonic schizophrenia, where they usually sit in a pose and they can sit like that all day until somebody moves them. And you'll see a couple more here at the end of this video here. People sit hiding their face or covering their face, covering their eyes, covering their ears. Very, very common among catatonic schizophrenics. They don't bother anybody, they don't say anything. There's somebody trying to cover their ears and maybe a little bit to their eyes. Here's a guy talking to his fingers. Here's a guy just staring out. They can sit there all day until somebody says, hey, Joe, it's time to get up. Gotta go eat, go to the bathroom, whatever. Well, I am. But don't come out going into a profession even though you suffer from a mental illness. I posted 2, maybe 3 videos of a lawyer with a PhD who is a instructor at law school in California who suffers from schizophrenia. And she is wonderful to listen to because you can tell she's very smart, very motivated, but yet about once every 3 years, her medication has to be adjusted. And when you do that, she checks herself into the hospital because they take her off of her antipsychotic medicine, which makes her worse. But you can't be on 2 antipsychotic medicines at the same time. And if one's not working anymore, they got to get it out of your system before they start you on another one. And the next one they start you on may or may not work. So it could be a problem when you're employed. So it's not a death sentence if you end up having a mental illness. Most mental illnesses can be treated with therapy and or medication. And there's another guy off the streets of New York. This one's kind of, the language in it is kind of X-rated, but you guys are all adults. If you're insulted by the use of harsh language, then you don't have to listen to it. May not get to listen to it anyway if it doesn't open it. Come on.
How you doing?
These two idiots decide for fun, they're gonna get their video camera and go look for mentally ill people. They probably know this guy. For mentally ill people in the streets of New York City, and then video and talk to them. And then they end up giving him some kind of certificate. But this is a guy who obviously dresses well, he speaks well, but he's probably on medication, maybe not, but he's definitely actively psychotic, even though he makes a lot of sense, but he's got a lot of delusions going on. Like right here, he says something about, you got any reefer, like you got any dope, you got any mota. And then he realizes he doesn't know these two guys, they could be cops. So then he changes his mind and says, no, I mean cigarettes, you know? So you can't be walking up to strangers and asking them for drugs because you get yourself in trouble. So he has enough social awareness to know that, but he's got other deficiencies.
How many you have to cigarettes? Alright. How you doing? Where do you stay? You're a meteorologist? Yeah, I would say so. And ping pong was played. You guys play ping pong? God, dog shot, what is that?
That is disorganized speech. And of course, these two idiots are egging them on. But even if they weren't egging them on, like Dr. Llewellyn wasn't trying to egg those patients on, these guys are, they're still gonna say odd things.
Oh, your dog was wearing a sailor hat? Yeah. What is this, John? Oh, yeah? But it's short, guys. Oh, yeah? So what do you do? You say, Obama. I did it? Obama, I love it. You look kill Obama, you said? I don't care, I'm assassinating.
You remember, like, what, the first week or first month that Obama was in office, he got the Nobel Peace Prize, and he got anything. Hadn't fallen down the stairs like Joe does. But he gets the Nobel Peace Prize. Now, he probably knows that. And that's what he's talking about. The Pope Prize, Nobel Peace Prize, goes to Sweden. I think it's the Netherlands, but whatever. So he's got a lot of funny things to say. And by the way, when he's talking about delusions are thoughts. The difference between delusions and hallucinations is delusions are thoughts. Like you think you're Napoleon. You think the CIA is out to get you, or you're a member of the CIA. You're a member of Mossad. Aliens are sending messages through your TV tube. Those are all delusions. Hallucinations is when you hear maybe that voice Michael inside the woman's head, or telling her things, and the one guy with the skull cap on, with the TV tubes, was talking about feeling things and things underneath his skin and in his head and all this kind of stuff. Are tactile hallucinations.
Okay. And I'm still. Is it your mom, Obama? No, a mom is your mom's. Obama's a man. Oh, Obama's a man? Yeah, man behind the wheel of a dark track taxi came in the back. So where are you headed? They hit the rest of your friends. Daddy, mom, sister, brother, and keep you as ranks. But Michelle Obama wore names was on Tim's and something. So what do you do? Well, I'm a Superman.
Superman?
Yes, I'll try a roll call. I've been on like this. 99.
See, there he is blinking his eye. That's his form of comedian. Like, I didn't call Ghostbusters. He says, I've been this way for 99 years, and he's winking his eye like, that's a joke. Of course, I haven't been doing it for 99 years. So he's got a sense of humor. He's got some ideas of what's going on, but most of his ideas are warped because of his illness.
Crazy, man. You're the coolest guy I've ever met in my life.
Wow. What's your name?
My name is Bobo.
Bobo? Well, we'd like to give you a certificate.
Oh, no, Bo. I don't want no discovery card. You'll make my lawn wet.
If you've ever gone to a big city like New York or Las Vegas, when you're walking down the street, they pay people to give out these damn applications for discovery cards and American Express and all this crap. This has happened to him, Dressed like that, somebody would probably think he's a high roller working on Wall Street. He can dress however he wants to because he's a billionaire, So they're trying to give him an application to discovery card he doesn't want.
We'll try not to do. But President Bush had a certificate.
Well, we need to put your name on it first, actually.
Oh, that's the last thing. Son, tobacco brain part.
You went that name on that. What's his name?
Oh, that's it. I can't even read.
Zachary. What do you go to?
No, you know what I
Give it
like?
Bobo.
My name, I like chalk. It is called, because I was going to get a newspaper cover.
You were in the newspaper? You were an editor for the newspaper?
Yeah, Mr. Hughes.
Giving an opposition. This is for Bobo. We present the state.
Yeah, I'm in China. I'm sorry, USA. It's American Afro Independence Day. But Michelle says she should be used to things. And that big 19 inches. Richard. And Michelle says she's.
That's almost too big.
But you know, say Richard Obama is 4 inches thick. He got bees, but he suffered by the peanut cold, a snail dog, black look. Whatever worked, you shrink.
Do you like John McCain?
Oh, wait, I ain't got to that. He might be a mine, but I tell you, Rich, Miss, she gonna get Reverend Lee Coming. And then she gonna be John Dillon, she read about me in the 1940. And she gonna be California, I walk along the cross.
Can I get a shot of you with a big smile with that certificate?
I saw him.
Can you get a big smile? Big smile with that certificate?
Say she. 20.
White.
Right.
White boys?
What?
White people.
And she.
That's slaves.
Mrs. Rice. Yes, sir. But she ain't gonna do this lot at all.
We don't really like white people, actually.
Huh?
We don't like white people.
Who are you? A bomb.
We're not white.
Oh, you picked that out, that goddamn thing, that was.
Yeah, that was what I was. Big smile with the certificate.
A Saturday Night Live.
Thank you.
Say something else. Delusions can come in any shape or form, but a lot of delusions are around power issues, people in position of power, like he was talking about Obama, and sex, he was talking a lot about sex, so it's an issue of power, persuasion, religion. A lot of delusions have to do with religion, ideas, and ethics, and whatever. So I could lecture about schizophrenics, but I think it's best that you can see them, examples of a few. Everybody's different, of course, but they share some kinds of things in common. And you notice none of these guys or gals acted in a violent way at all. The Bobo there got a little mad, but he got over it very quickly. He didn't act aggressively. He just was mad there for a minute. So let's talk about this handout. I don't know, did you get this one? You probably didn't get it.
No, I did not.
This is a picture of the psychiatrist who was treating James Holmes from the University of Colorado, where he was a neuroscience PhD candidate. He got his master's in neuroscience, and let me tell you, neuroscience, even at the bachelor's level, is a very tough discipline. So James Holmes is a really smart guy. Question?
What does the headline mean? You can't kill everyone?
You can't kill everyone? That's a quote that the doctor said that James Holmes said. James Holmes sent her a diary of his the day that he went on a shooting spree. He put stuff in the mail. What he did was he killed some people in his dormitory. He did a little video and then he recorded it. He boxed it up. He got in his car. He drove downtown, put it in the mail system, came back, got his gun, and no, I'm confusing two people. No, that's not true. That was Cho. I'll talk about him too. No, he had a diary that he sent to the doctor through the mail. But I'll talk about Cho in a minute. I get my characters confused here. Anyway, Dr. Fenton was the chief administrator of the neuroscience program that James Holmes was his PhD candidate in. And I might have mentioned to you before that statistically, if you're going to have a problem with schizophrenia, it's more than likely going to occur between the ages of 17 and 27. There are exceptions. There's a famous case, if you want to look it up, I guess I could have posted it, but I didn't this time. It's of a JetBlue captain who was probably in his 50s. Anybody who flies aircraft has to have, especially commercially, has to go through rigorous physical and mental tests every year to make sure they're good to go. And here's a guy who's never had any problem, didn't have a problem with alcohol, drugs, emotions, or anything. And then he's in his late 50s and he has a break with reality and has a schizophrenic episode while he's piloting a plane for JetBlue. He gets up, he starts screaming, he's running up and down the aisleway in the aircraft. Of course, the co-captain is flying the aircraft while the captain is running around in a schizophrenic episode. And this was after 9/11, so the protocol is that a lot of the attendants, the flight attendants and passengers in the plane got up and jumped on the captain and subdued him and tied him up and took him to jail, took the airplane to the nearest airport, and the federal authorities came in, arrested him, took him to jail. He got a lawyer, and his lawyer was stupid enough to get on TV and tell everybody that he was not mentally ill, he was just tired and probably dehydrated, and that's why he had this little problem And I talked to him today, he's fine, he's calm, he's not talking odd or anything. And then like a day later, he had another psychotic episode while he's in jail. And then people had to admit, this guy's got a mental problem. But the good news is, he didn't get it until he was later in midlife. And people who have an acute onset of an illness like schizophrenia, if it's in a acute stage, meaning rapidly, they're the ones who generally respond to medication quicker, faster, and more long-lasting. People like the kids I used to deal with that were institutionalized and they're only 8, 5, 10, 12, and they're schizophrenic, they're suffering from schizophrenia, that's not good. Not good. And more than likely, they will not be teaching law at University of California like the professor that I have a video or two on Blackboard. But hers is a very interesting case. So it gives hope to people who do have mental illness. As I always say, every semester, at least when we're having face-to-face classes, every semester, somebody generally comes up to me after class and tells me that they are being treated for some kind of mental illness. It's very common, it's not uncommon. It's not uncommon that people can go and do well in school and do a lot of things. Now, somebody who did not do well in school was Cho from Virginia Tech and Jared Loftner from Pima Community College over in Arizona. Loftner is the one who ended up killing a federal judge, a little girl that had come to listen to Congresswoman Gabby Giffords. Gabby Giffords got shot in the head and had to go through all sorts of rehab to be able to talk and walk. She obviously got out of the House of Representatives in the federal level, and now her husband, who's an astronaut, is the state senator, one of the state senators from Arizona, who ran obviously in a political race. So I looked up, but I didn't get the answer because I guess I was on to something else. I meant to look about what is the status of all these lawsuits against Dr. Fenton and the University of Colorado. We were discussing a little bit before the camera was rolling, and I was saying in the James Holmes case where he was the joker that shot the people up in the movie theater in Aurora, which is a suburb of Denver. My sister used to live in Denver, not very far from Aurora. And by the way, Aurora is also where Columbine is. If you know about the Columbine boys, that was in Aurora High School. So Aurora's got something in the water or something not good happening in Aurora, Colorado. But James Holmes started some of this schizophrenic type behavior, and when you're in a neuroscience program, virtually every faculty member and a bunch of students would be knowledgeable enough to know that you've got problems. And the girl that James Holmes was seeing actually went and told the authorities that she thought he was getting seriously mentally ill. And of course, he was saying things in class, and so they went to him and said, look, buddy, you got two choices. You can either leave the school, or you can consent to going into therapy once a week and stop having these outbursts in class and blah, blah, blah. So he started seeing Dr. Fenton, who is a licensed psychiatrist, and she just, in my opinion, screwed up. Like I said, the smartest person in the group was the police lieutenant who asked the doctor, hey, you want us to pick up Holmes and take him down for a 72-hour evaluation, which, by the way, most states have a provision that law enforcement or somebody can intervene on the behalf of somebody. Doesn't have to be a relative. Often it is a relative because they're the ones who knows what's going on, and get somebody committed to the hospital for the purpose of an evaluation. The purpose of the evaluation is not so much to figure out whether they are mentally ill, but to figure out whether they are a danger to themselves or to others. Because you can be perfectly mentally ill, but you're not dangerous to yourself, you're not going to kill yourself, you're not going to harm somebody else, and therefore you cannot be held against your will in a mental health unit in a hospital or in a mental institution like I used to work in. So they get out as long as they're like the first guy that we saw that was delusional, paranoid schizophrenic. In all likelihood, he got out of that mental institution the next day. Number one, he's self-admitted, and number two, just because he's paranoid doesn't mean that he's a threat to anybody. Now, the people that we find out that do these shootings generally are paranoid schizophrenics. So Jared Loeffler, James Holmes, Cho. How are we doing for time? Okay. I want to make sure I leave you some time to go over questions. Since I won't see you again, I'm going to release the tests this Friday. I'll give you a long time to take it. I'll give you to like next Wednesday, because exam week officially is next week. So you don't have to take the test this weekend. But if you want to, because you got other tests you have to take, it's up to you. So I'll give you a long window from Friday to Wednesday night to take the test. Yes?
I was gonna ask if this isn't too much trouble to check my score overall, because I want to make sure I'm like passing, like.
Yeah, well, you can do it, but
I think I like missed one of the exams, but I did the last exam.
okay.
I just want to make sure that I'm like.
It's always good to be careful. We'll do
I'm
that.
like, oh, no.
We'll do that. We'll do that later. So nobody has to be involved in that except you and I. Okay. Let me see.
Anyone want none?
No, thank you. Let's see. Now, this is a video that Jared Loeffler from Pima Community College made. I don't know if this was part of an assignment, or whether he just on his own decided he was going to make this video, but let's take a watch.
We're examining the torture of students. We're looking at students who have been tortured. Their low-income pay in 2 wars. The war that we are in right now is currently illegal in the Constitution. What makes it illegal is the currency. It's also wrong. It's impossible for the it's mind control. How's it going? Thanks for the feed. I'm just that. Class, I'm being the stage that guy. And this is what happens. And I'm in a terrible place. It's food I gotta do. This is my genocide school. Where I'm gonna be homeless in the school. I forgot the teacher that gave me the lead for freedom of speech. My sociology class was. This is Pima Community College, one of the biggest scams in America. The students are so illiterate, and it affects their daily lives. Here's the best part of the bookstore. The bookstore. It is so illegal to sell this book under the Constitution. We are awesome.
You can see his delusions all have to do with the grammar, with money. He calls it the First Amendment, but it's not the First Amendment. Money, teachers are not being paid right, don't have the authority to teach, and all these kinds of things. He's got lots of delusions going on. None of it paranoid, really.
Subject by our freedom of speech. They're controlling the grammar. They control the grammar. This is a police station. This is where the whole shabuzi goes down with illegal activity. If the student is unable to locate the external universe, the student is unable to locate the internal universe.
Must have been taking a philosophy class, huh?
But it's all my subjects. I can say something sounding out, but I don't feel like it. All the teachers that you have are being paid illegally and legal authority under the Constitution of the United States. This is genocide in America. This is Jerry from college.
I don't know, was maybe he was doing this video for a class because he talks about genocide in America. Of course, that doesn't make any sense, but that's what he's talking about. I must have put Joe on Blackboard for you. There's Dr. Sachs. She's the professor I was telling you about. See him there. That is not right. Let's see if I did the show. This is not where it's supposed to be. Oops, not page 10, I mean. Oh. Well, this is an interesting video here.
If the brains of psychopaths do function differently, does this mean that the structure of their brains is different? Bob Hare, Andrew Smith, and their colleagues employed magnetic resonance imaging, or MRI. This technique allows researchers to study the brain in fine detail from many angles. So far, the results of this technique have not revealed.
If you've never seen an MRI, this is what it can do. It represents any part of your body perfectly in 3D. So then they can section it out, they can slice it up. On the side here, they've just taken a section out, and everything is exactly where it is in your brain. So if you had a brain tumor, I mean, all this dark area is fluid, but of course we have ventricles in our brain. So it's not that unusual, but if he had a tumor, this person had a tumor, you'd be able to see it really easily.
Feel any structural differences. One of the most convincing studies of the brains of psychopaths involves single photon emission computerized tomography.
SPECT scans. SPECT scans is where they inject you with a radioactive dye in glucose, which is sugar, you know. And when your brain works, just like when your muscle works, waving your hand, that takes energy. When your brain works, it takes energy. It sucks up glucose into the cells, and when it does that, it takes the radioactive dye with it. So what Dr. Hare, who's the world expert in psychopaths, he takes these folks, some are normal, some are psychopathic, and puts them in a MRI machine and reads where the radioactive dye is going. And it's controlled by colors. So down here are the darker colors, very low amount. The highest amount is up here, which is white. That's the most. And then down below white is red, down below red is orange, down below orange is yellow, then green and blue. So when you're looking at this SPECT scan, this is your brain cut across the top and opened up, basically. That's it. You'd be looking down through your brain with the top of your head taken off, so you can see what it looks like. That's what you're looking at here. And, well, we'll let him explain what's going on.
Or SPECT. In this process, harmless amounts of radioactive tracers are injected into a subject's bloodstream. Activity in specific areas of the brain can then be observed. The white and red colors indicate the areas of highest mental activity. The green and blue colors indicate less activity.
The SPEC study was done
in New York at the Bronx VA Hospital under the direction of Dr. Joanne Inkertor. And it was the first of its sort ever done. Nobody ever looked at psychopaths before in this particular way. And the task was the lexical decision paradigm. Again, a letter string flash on the screen will either form a word or will not. And you decide as quickly as possible if you see a word by pushing the button. And some of the words are neutral in connotation, some are emotional or affective in connotation. And we know from other studies that normal individuals process neutral and emotional information differently. We also know from event-related potential studies measuring EEG, intellectual decision path, that psychopaths actually differ from normal individuals in the way they process this sort of information. To make a long story short, the psychopath seems to process, interpret, process, and perhaps use emotional information as if it was neutral information. So the brain potential that we would record from the surface of the skull, of psychopaths, would look the same to neutral as to emotional words in this lexical decision paradigm. Quite intriguing, and tells us that perhaps the psychopath doesn't really extract emotional information from words in the same way that most other people would do. So this led to the brain imaging study, the SPEC study done in New York. The normal individual, the non-psychopathic individual, shows widespread activation of the brain in performing this particular task, which makes a lot of sense if you think about it. The task is simple on the surface, is that a word pushes
The eyeballs
but on the other hand,
would be up here.
processes involved are very complex, many different parts that would have to be activated.
This is basically the same view that you were looking at with the MRIs. So it's as if you cut the top of your head off, took it away, and then we're looking down from the top. So your eyeballs are here, and you're looking this way, okay? And you will see that this red area is pretty hot because this is the back of your head, and this is where your visual cortex is. So when you're given a list of words, which is what he's talking about, so he'll give you a word like book, and then a word that's not really a word, and they'll tell the person in the MRI machine, they'll flash them a set of letters. And if it is a word, hit the plunger. And then they'll flash them this. Is it a word? No, don't hit the plunger. Okay, here's another word. Is that a word? Yes, hit the plunger. Is that a word? Yes, hit the plunger. Now, what he's going to show you in neutral words like chair, book, bag, cat, there's a certain amount of areas of your brains that are a brain that is activated. You have your visual cortex, you have other portions of the brain which are involved, thinking parts where the white is, and that's how you figure out whether it is a bunch of letters or whether it is actually a word. However, they put in these emotional words, which any of us, when we get a SPEC scan like this, not only does it fire up the normal things get fired up. Is it, these letters, a word? What does it mean? Yeah, okay, I got it. But if it's an emotional word like rape or kill, decapitate, there's other emotional sections in our brain that get all fired up because we're talking about rape, we're talking about cancer. You can't just see the word cancer and say, oh, that's like camera, cancer, camera. They're the same.
I got another one. I got another scary word. Student debt.
Who?
Student debt.
Okay, so with that explanation, I went to meet him at a conference in California for forensic psychology. I brought his book and he signed it for me. I couldn't get anybody to take my picture with him. He's a little short guy. He's only about that tall, smart as hell. He got to the podium and spoke for like an hour and 45 minutes, no notes, nothing, just zip. Really, really interesting guy.
And this is exactly what we find with the non-psychopathic individual in this task, and it's represented by widespread activation in the brain, indicating that language areas are highly activated. You can certainly see them.
These are language areas.
And some activity towards frontal part of the brain. In fact, there's a very nice anterior-posterior gradient where most of the activity is towards the frontal front part of the brain. Also some activity on the right side as well. Now, for the emotional words, which are all negative in connotation, we see that there's fairly substantial activation in the right hemisphere as well, which is not unusual. We know that the right hemisphere plays an important role in processing negative emotion, negative affect. If we look at the psychopath, we get quite a different picture. And in fact, the slides themselves are almost too dramatic. People would look at them and say, well, there's something wrong here. Are you really looking at somebody who's awakened?
Now, this is where you get to tell the difference.
Individuals were active. They were performing the task as well as the non-psychopaths performing, but different parts of the brain were activated. You can see quite clearly that, in fact, the part of the brain that was activated most was the occipital cortex, the back part of the brain. This is
Right.
intriguing.
This is the visual cortex.
The input is visual, so much of the information is going to the back part of the brain for initial processing. Then, of course, presumably it should move forward, backwards, up, down, and around different parts of the brain, but this doesn't seem to be happening here. The psychopath.
So here's the right side, which we saw on the other video on the normal negative emotions. It was all fired up here. Here, very little. Nothing really going on over here. Some red, of course. But watch, this is again the psychopath. Watch the normal person.
The task is being performed primarily in the posterior parts of the brain. Now, we know from other studies involving brain imaging studies that, in fact, it is possible to make a decision on whether or not what you see as a word in the posterior part of the brain. It's not necessary that other parts of the brain become highly active. But it's pretty hard for a normal individual to see a word like cancer.
There you go. This is the normal reaction. Look at all this action in the right hemisphere, a lot more in the left as well. But you remember the psychopath, it was all down here in the back of the brain, which is visual, obviously, and then there was this one little hot spot of white. That's it. So just from this SPECT scan, you can see physiologically there is a big brain difference between psychopaths and non-psychopaths.
Or rape or death, without actually drawing all sorts of other associations, cognitive affective associations. You may have an image, conscious or subconscious, of what's going on. You may think of somebody, oh, do I have cancer? All these different things. And this would activate other parts of the brain. For the psychopath, that seems to be seems not to be the case.
Just back here, in one little section there.
Is it a word or not? Who cares what it says? I'm going to process it the same way in a very superficial manner. What we're now beginning to believe is that the psychopath is not characterized only by some sort of difficulty in processing and using emotional information. We're beginning to believe now that, in fact, the problem is much deeper than that. And I suppose one could describe it by saying that the psychopath is an individual who is not, either not capable of or that typically does not engage in deep semantic or affective processing. It's almost as if everything that he or she does is fairly superficial on the surface. And a couple of fairly recent studies that indicate that this is probably a pretty viable line of research to pursue. It's looking at the deep semantic and other process. Maybe it's not restricted to semantic process. Maybe it's that deep processing of any sort is a difficult thing for the psychopath. For individuals who are critics or observers who say, well, these brain images are very interesting, does that represent some sort of brain damage, or does it mean that they're wired up differently, or these people are simply different inherently, genetically, or biologically? Well, we don't really know. The images themselves don't really tell us what the cause of the differences is. It's quite possible that the differences we see, and this would apply to many tasks that we use in study psychology, it may be that the differences are primarily the response of difference in strategy. It may very well be that they can.
Well, let me tell you the name of another neuroscientist who did the one experiment that I've been talking about for years, and they already did it. His name is Adrian Rain. He's a psychologist, but he specializes in criminal justice issues. And there's an island, small island off the continent of Australia called Mauritius. And when he was a graduate student working on his PhD, or maybe he had already gotten his PhD, he was involved in a study by one of his professors where they went to the island of Mauritius. They got permission from the government, and they did a brain scan on every single child in the island at 5 years of age. And the reason they chose Mauritius is because it's a small island. It doesn't have much movement. Nobody generally comes to live to Mauritius, and people who live in Mauritius generally stay there. They don't leave the country. So it was a stable population, and it wasn't so large that they couldn't capture every 5-year-old on the island, and they did it. They did an MRI on every 5-year-old, and then they did follow-up studies. So I have a section of a book that Dr. Rain has written, and he talks about 20 years after he was working on this experiment when he was in graduate school. 20 years later, they went back, and Dr. Rain chose the MRI from a female and the MRI from a male that looked to be the most consistent with what a typical psychopathic brain would look like from a neurological point of view. So the dude, he found him. This guy had a long rap sheet, been arrested, been to jail numerous times, trouble with the law, broken relationships, all sorts of stuff. Big time antisocial guy. The female, on the other hand, was a very attractive woman. She competed for the Miss Mauritius World competition. She became Miss Mauritius, went to the world competition. She didn't win Miss World, but she is very attractive. And you can look her up on Google. And so the explanation is you can have the brain morphology, but you're still under the influence of our famous diagram, psychosocial, and as you know, with the arrows, that means they're interacting, it's dynamic. So both the male and the female biologically at 5 years old had a brain difference than other children their same age. And at the age of 20 or 22, the guy, the male is a hoodlum, and the female is like a superstar. Her job is selling, being a promoter, because she likes to engage. She's very people oriented, and you know, it helps if you're very attractive. You're trying to sell your product, whatever you're trying to sell. As Miss Marita, she was trying to sell the country. So I think Dr. Hare has the right idea about, does there seem to be certain brain areas that seem to be associated with psychopathic behavior. Now, you might remember from week 1 of this class, there was a video by a man who was a neuroscientist, and he used to read MRIs and functional MRIs as a living. James Fallon, go back and look him up. He's in that first section of mods 1, 2, 3, and 4. James Fallon. And he talks about the 3 things that it takes to create a psychopath. You got to have the right genes. You got to have the right anatomy, which is what Dr. Hare is showing on this line of inquiry. And then number 3, you got to have that childhood trauma. How do we know that? Because here in Chuco Town, we created Richard Ramirez, who had the genes, he had the brain morphology, and he didn't get the childhood nasty experience till he was a late adolescent. And between those 3 things put together, he became the Night Stalker, I guess he was. He moved to California and started raping and killing girls, women in California. Right out of Segundo Barrio, he went to I can't remember the name of the high school. It's there by the hospital. It's by University Hospital, Texas Tech. That high school is where he went. One of my students' boyfriend's mother dated Richard Ramirez when she was in high school. She said he was great, really nice guy, great kisser, very kind, very respectful. He was an altar boy. He didn't get messed up till he was around 18 or 19, and his uncle was showing him pictures of all the trophies of people that his uncle had killed in the Vietnam War. It's a bad thing sending a psychopath to a place to kill, because they like killing, and he apparently did a lot of killing and a lot of trophy taking, cutting off ears and other body parts. He also killed his wife right in front of Richard Ramirez in the kitchen. And Ramirez saw that, witnessed it, and his uncle got away with it. Said it was self-defense, and so he got away with killing his wife. So Ramirez didn't stick around much after that. he jumped a train, went to California, and started his life as a serial killer. So I don't want to confuse you about the difference between schizophrenics and serial killers, but that's just a little bit of forensic psychology I threw in at the very end here because I couldn't find the video I was trying to show you. But that's okay. That's how we end this semester, with a little bit of understanding of serious mental illness and a little bit of forensic psychology, which I have a big interest in. So, all right. Any of you guys have any questions about your Mod 43 study guide? See how we're doing for time. Yeah, we're actually doing pretty good. Let me just look through a few questions here. Looks like page 1 is talking about symptoms. Like, let's look at number 5. Positive symptoms of schizophrenia, which means added symptoms. So positive symptoms of schizophrenia are the D, presence of inappropriate behaviors, and negative symptoms are the absence of appropriate behaviors. We saw both of those in that one female patient. She showed both of those, positive symptoms and negative symptoms. Number 6, people with schizophrenia who experience hallucinations, that's something added, so that's a positive symptom. Not positive meaning good, but positive meaning it's been added. Okay, this is all about positive and negative symptoms. Number 9 has to do with schizophrenia, where that's delusional thinking, that he thinks he's Napoleon and all that. Number 12, in which type of disorder is a person's speech likely to be so full of unrelated words and phrases that it could be characterized as word salad? Obviously, schizophrenia. Flat effect, and this is number 16, flat effect and catatonia are symptoms most closely associated with schizophrenia. Obviously, that's what we're talking about. Now, unless you took some class like developmental psychology, you probably have never heard of the term impaired theory of mind or theory of mind. But number 19, Marcus, who has schizophrenia, cannot read other people's emotions or their state of mind. Marcus symptoms indicate D, an impaired theory of mind. Interesting, Dr. Hare mentioned that psychopaths don't seem to be able to see things and feel things the way we do. That is one of the symptoms of psychopathy. Number 27, schizophrenia is associated with an excess number of receptors for dopamine. Dopamine is associated with psychosis. Serotonin is associated with depression. there's a fair amount of questions that are anatomically associated, like 31, 32, 33. I'm going to try to stay away from using those questions. I can't guarantee all of them, but I will try to limit those not because we don't want to understand biological psychology, it's just that it takes some time to go over it again and again and again. And most of you are not going into psychology or going into the medical field of some sort. So now 34 might be an exception to the rule. I told you when we were looking at one of the scans that the dark area was where fluid is. We all have fluid-filled areas of our brains. And in the question 34, it says, among schizophrenic patients, the fluid areas of the brain, which is called the ventricles, the ventricle areas of the brain are A, abnormally large. So, as you know, I can't draw very well, but if we were comparing the normal ventricles, which might be a little spot like this in a MRI, in a schizophrenic, it might look more like that. So again, as Dr. Hare mentioned, we don't know whether the larger ventricles assist in somebody becoming schizophrenic, or does the schizophrenia create through biomarkers and epigenetics a larger ventricle? Seems like to me, if we look at Adrian Rain's study that says, I can look at a brain scan from somebody who's 5 years old, doesn't have that much social influence in his life, his or her life, except for attachment, and yet they can be a good predictor of who might be a problem. Obviously, Miss Maritas was not an antisocial problem, where Mr. Maritas, the guy who had the worst looking brain scan, he turned out to be the hoodlum, the antisocial guy. I'm not going to say he was psychopathic, but he was not doing well. 35 brain scans have found enlarged fluid areas in people with schizophrenia. Low birth weight, maternal diabetes are known risk factors for D, schizophrenia. Okay. What else do we have here? Number 41, research on the causes of schizophrenia strongly suggests A, there is a genetic predisposition. 87% of people who suffer from schizophrenia have a genetic connection, meaning somebody in their family tree has had schizophrenia or other serious mental illness. But that also means 13% of the population doesn't have any history of schizophrenia, but yet somebody's getting it. So if we look at our JetBlue captain, maybe he's one of those people that in his family tree, no suggestion of mental illness or schizophrenia, but yet he gets it. Well, here's another shocking fact. You take identical twins, one has schizophrenia. What is the percentage? What is the chance that the other one is going to get schizophrenia? Identical twins. If you're like me, you would say pretty high. But of course, you would be wrong because it's only 50%. So if you're identical twin has schizophrenia, you have a 50% chance of getting it, 50% chance of not getting it. Why is that? Because of our triangle that I already erased, biopsychosocial. It's not just the genetics. You got to have more. "42, if identical twins share a single placenta rather than having separate placentas, their chances of being similarly affected by schizophrenia are dramatically increased." So by dramatic, it must be more than 50%. Okay, it looks like we're getting into dissociation. 45 is a dissociation question. Looks like that's the first one. So on page 9, disruption in conscious awareness and sense of identity are most characteristic of a dissociative identity disorder, DID, or in this case, they just call it dissociative disorder. The official name is dissociative identity disorder, DID. So some questions about that. I didn't realize there was that many questions on associations. I'll try to stay away from those questions. It'll be hard because I'm going to ask you 50 questions and you only have what, 95 questions. So every other question will be on the test. So I'll try to stay away from, I haven't done the test yet. I'll try to stay away from the as many of the biological ones as possible. So, but as always, if you have questions on the study guide, shoot me an email since we only meet once a week. If you want, you probably figured out by now, we've been doing this for all semester. You can go on my YouTube channel and you can see my lectures in my 10 o'clock class. So like tomorrow I have class at 10 o'clock. I'll be going over these questions. So maybe they will ask more questions than you guys did. So that's available to you. But in addition to that, you can always send me an email. And if you want a review session, you're welcome to do that. We can do it. Like I said, I'll post the test on Friday and I'll give you till Wednesday. It's a long time. Friday, Saturday, Sunday, Monday, Tuesday, 6 days to do it. So you don't have to cram this weekend and do it. Take your time. You only got 95 questions. Half of them, 50, will be on the test. So make sure you have all your handouts, like this one. Other ones I gave out earlier. But if you obviously you figured out by now, if you answer the questions on the study guide and they're correct, well then that can help you greatly when it comes to taking the test. All right, I can't tell you how much I appreciate you guys coming out every Wednesday night because it's hard to do when you've been working in the day and have other things going on and people carjacking and shooting people on I-10, all sorts of stuff that was happening tonight. Craziness. So, good luck on the exam, and don't hesitate to contact me if you need any help in preparation for your exam. Please look at your scores on Blackboard, make sure you're not missing a test. Because you miss one test and that'll really have a really ugly negative impact on your grades. Good luck with your future classes.